Hello, and we're live. My name is Melanie Dizon. I'm the Director of Education and Content at the Davis Phinney Foundation, and I'm happy to be here today with Karen Frank. How you doing, Karen?
I'm great. How are you?
I'm good. I'm good. So it's been, aside from just the last couple of minutes, it's been a minute since we've chatted, and there's a lot been going on. So I would love to hear what you feel comfortable talking about, and I know that mental health and Parkinson's and addiction are super important to you. And I'm actually going to put up that link because Karen and I did an interview about addiction and Parkinson's, and I'm just going to put that up so people can find it. I should have had it ready, but I just didn't. Here we go. Substance abuse, recovery, and Parkinson's with Karen Frank. You guys can check that out. So I know this is a topic that's super important to you, and it's very present for you in your life. Even though like we'll talk about, you've been sober for a really, really long time. But let's talk a little bit about what happened. Well, I guess it was early in 2022. Is that correct?
Yes.
Okay.
Yes.
Um, let's talk a little bit about who you are and how long you've been living with Parkinson's and how you found the Davis Phinney Foundation to get started.
Okay. I have been living with Parkinson's for 5 years. I was diagnosed when I was 47 years old. I'm now 52. I, uh, just for background, have been living in sobriety most of my life, more of my life than I haven't. I got sober when I was 19 years old. So
Wow.
I've been sober 20 of the last 32 years. That being said, obviously, I've hit some bumps in the road over those years and had periods, short periods, where I was not sober. But that is a big part of what happened for me this year. And I think it came on the tails of grieving and coping and perhaps thinking I was heading in the right direction and was actually heading in the wrong direction. But how I became affiliated with the Davis Phinney Foundation is I've just been very impressed with the Davis Phinney Foundation and their dedication to helping people to live well with a disease that as of yet has no cure. And I'm impressed with how this organization addresses everything from hobbies to serious issues and medical pieces to life enjoyment and coping skills. And so I feel that you stand for what I stand for, so that's how I became affiliated with the organization.
Oh, I love it. So something stood out to me just then. You said, I thought I was going in the right direction. And that didn't end up being that way. And by the way, hi, Audrey. So good to have you here today. And if you guys are in here and want to say hi, we'd love to hear from you. And also, if you have any questions for Karen or me while we're talking, feel free to shoot them in the comment section. But yeah, so what was that piece of feeling like I'm going in the right direction and it wasn't quite so right?
Well, I think there's a certain when you're first diagnosed, there's a certain grace that I think most people will give themselves, like, hey, this was hard. I'm going through a lot. I'm going to need some time to adjust. I mean, I lost a career which I really loved, and I
Yeah,
had,
and it was a big one. Why don't you tell everybody who doesn't know what you did?
yeah, I was a nurse anesthetist. I had a career which I really loved and was good at. Excuse me. um, and the dog decides right now to
Yeah,
bark.
it's
See if
okay.
my husband gets the dog. He's also on meetings. So anyway, I may have to travel and
That's okay.
um anyway, I've been somebody who's lived the majority of my life in sobriety, and I'm not afraid to talk about these things that I have had as challenges, because part of what's helped me is to help others. And that's even in fellowships that I participate in, it helped me with my sobriety and living well. I help others, sponsoring other people, sharing about my experience, strength, and hope, really just being there for others in that way has really, really helped me. But even in trying to be there for others, I didn't even realize that I wasn't being there for myself. And
Mm.
there was sort of a tipping point. Like I was trying to help myself with I had a lot of anxiety, which was a big symptom of mine with the Parkinson's.
Did it I mean, was it like many, many, many years before you were diagnosed or?
Several years before I was
Uh-huh.
diagnosed. I mean, I had a really high pressure career and I could handle stress well. That was part of my job, and I was supposed to be able to do that. And suddenly I wasn't able to do that very well. I didn't realize it was Parkinson's related, but I even, um, I was 13 years sober when that happened and very strongly entrenched in sobriety and a commitment to that. I mean, I love being sober, but I was having so much anxiety and side effects from the medications. And I decided that I would try cannabis as a sober person.
Were you, just because I know people care about and will ask, what medications were you on for Parkinson's before you tried this?
Carbidopa, levodopa. I tried dopamine agonists. I tried a number of different medications. I had a lot of nausea and vomiting. I had early, I just had a lot of side effects from the medications. And I really felt that I was helping myself.
So
Um,
did you go off those any of all those medications to
there
try
were
it?
times when I tried different ones. I mean, at the guy's, direction of my physician.
Sure.
He actually was open with my physician about what I was doing or thinking of doing. And I thought long and hard about it before I did it. I talked with other people in the recovery community about it, my family, my husband. I didn't just go off and do it. Um, at first, I was really careful and like metering the teeniest doses. And
And were you doing edibles or?
I tried different things. Like I
Okay.
tried a vape pen, I tried edibles, I tried different things, but I was so careful. And then somewhere along the line, I just remember as a recovering human, this moment where I tried it and I took a little more because I was slowly upping the dose. And you know what? It felt good. I
Mm,
was like, I wasn't um, anxious anymore. And I was feeling relaxed and I wasn't as worried. And I had not experienced that in many, many, many years. And I think I knew deep down in my heart that this might not be good. Like I'm only supposed to take it small amount to help me minimally, not to feel high or something like that.
right.
That was really important to me. And somewhere along the way, I'm like, well, it felt a little bit high. I guess that's okay. Nothing happened to me. I'm still functioning okay and I'm doing great. And, if you use that medication or substance, however you want to look at it, long enough and enough of it, you build up a tolerance. So you take more. And then the side effects, I think, are more prominent. And for me, I didn't even realize that I was getting quite paranoid. Um, I was getting um, much more anxious. And I have a sibling in sobriety, and he even said, well, maybe it's making you more anxious, not less anxious. I'm like, no, 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 no. If I didn't have this, I'd be really anxious.
Yeah.
Think about that. And, I just sort of, then there was this sort of duplicitousness to what was happening to me. I was affiliated with an organization about living well with Parkinson's. I was speaking all across the state of Missouri to groups of physicians and nurses about addiction and alcoholism and how to balance getting sober in their career. I actually, when I quit working in anesthesia, I actually started volunteering and I was speaking all around the state. And so here I was using cannabis and sober and very public. And I didn't feel like I fit in there and I couldn't do that. And as things started unraveling and I started having more issues, I really didn't feel like I was living well. And I was embarrassed about it. And I felt a lot of shame about that because that's not really my hope or goal or wish. I really am quite resilient and dedicated to my mental health and that kind of thing. And so when it started to slip, I didn't really recognize it as happening. And some years went on, and I just got worse and worse and worse. And the thing that helped me, frankly, was having a community that I was really involved with, and people who knew me and knew that my behavior seemed odd and I was not acting myself. And people who cared and about me and loved me very much reached out and contacted my husband and tried to help me get back on course. And true enough, I really did need some assistance. But what happened to me in the long run was I, at the first time in my life at age 52, developed a drug induced bipolar disorder and a true manic episode where I was completely off the rails. I began hallucinating. I was auditory and visual hallucinations. I I was using more and more and more, and I didn't. I there was a point at the very end where I was like, oh boy, we're in trouble.
Well,
And
how when you say at the very end, how long was it going on?
this happened so I was diagnosed in 2018, and in 2019 I decided to try the cannabis, and I just actually dealt with this full on relapse and went to treatment for it
Right.
in
Wait, so okay, so you
summer.
definitely started that cannabis early, but wow, that's super helpful. And then the piece around the manic
So this was
episode.
the big shock. So I wasn't I wasn't self-aware of my own behavior. I didn't even know. I actually felt quite good because I had this very like energy. I wasn't really sleeping. I was quite creative. I was having these expansive thoughts about all these wonderful things that I was doing. And they were true things that I was doing. But I just had this sort of loss of touch with balance and reality and that kind of thing. And I really didn't know it until everything kind of came to a head. And I actually was having the hallucinations for a very brief time. And I ended up, I saw my neurologist. He knows me quite well. He knew my father. He was my father's neurologist. We have a special relationship. He knows that I had been sober. He knows about my mental health. And I mean, I've struggled with depression and anxiety at times in my life before Parkinson's, but when I got Parkinson's, it was worse, whether that's from the chemical imbalance in your brain that you get from Parkinson's, the side effect of the medication, grief and loss, coping, who knows? I mean, as my psychiatrist says, you have one brain, right? And that brain has other conditions, recovery, it has Parkinson's. I mean, you can't just separate this part of the brain is that, and this part of the brain is that, and this part of the brain is that. It's one brain. So when things fell off course for me and I was really harming myself and not helping myself, I didn't know. And I saw my neurologist in May of this year. And after my appointment, I mean, the appointment was 2.5 hours long. He knew something was wrong. My behavior was odd. I was irritable. I was almost yelling at him. It just wasn't me. I'm a very kind and gentle soul, and I wasn't acting normal. And my husband even was looking at me like, what is going on? And I sent my neurologist 13 emails after that appointment, asking questions. And I thought of things and I couldn't stop. And I just kept emailing him and emailing him and emailing him. And finally, he said to me, you need to call your psychiatrist. And I was like, I thought he was blowing me off and he didn't care or whatever. I thought, I mean, I wasn't really thinking clearly at the time. He really was literally saying, call your psychiatrist, something's wrong. And it wasn't several weeks after that I ended up in a hospital. I mean, I actually spent 3 days in 3 different hospitals trying to get help
Ugh.
in a psychiatric hospital for the first time in my life. And it was frightening. It was terrifying and scary. And
And you were
uh,
by yourself?
well, you mean in the hospital?
Well, like you went to 3 different hospitals. Is your husband
Well,
with you? Was it
we called my psychiatrist
Uh-huh.
and we said, something's not right. We need a hospital. We need to go. Because the neurologist told me to go. Unfortunately, she told me to go to a hospital that didn't have a psychiatric
Mm.
um, center. I don't know
Mhm.
why.
Mhm.
It just was bad advice.
Mhm.
And we ended up there, and they sent me by ambulance actually because I was fit to be tied. I mean, I was just cuckoo for cocoa puffs at that point, and they took me to the only bed in the city because of COVID and everything that was available, and it was unfortunately a really dark and dingy and scary place, and I'd not been in a place like that, and um, it was horrible. The conditions were horrible. I don't even know if I want to talk about it because
Mm.
it was horrendous. And I mean, I asked my husband to come and get me. And so he picked me up. I mean, they couldn't keep me against my will. I wasn't a danger to anyone. I was just sort of annoying more than anything and obviously ill and needing help, but I wasn't a danger to myself or others. So they couldn't keep me. And my husband took me home and we called my neurologist. And he's like, Karen, you're still quite ill. I'm not sure what's going on, but I need you to go back to the hospital. I'll have the neurology residents meet you in the emergency room. And I'm like, please don't make me go back there. And he was like, you have to go back. And I said, okay, because I trusted him. And my husband took me back. And that was now my third hospital in as many days. And I I got admitted and because I was stabilized pretty quickly with medications, my neurologist got on the phone and actually suggested certain medications and what to avoid more than suggesting certain medications. I was stabilized enough that I convinced them to let me go to a medicine floor where I could be managed and my neurologist could come and see me.
So what is a medicine floor
I
for
wasn't
people?
on a locked psychiatric unit
Oh, okay, okay,
at
okay.
that
Just
point.
regular floor of the hospital. Yeah.
Yeah. And I I was in the hospital for about 3 days and they stabilized me with medication. And it was clear that I needed to get off the cannabis and that was contributing to it. And I knew that I needed to go actually to rehab. I had gone before in 2009 and I have been sober, like I said, since 1990. So, I mean, I knew what to do. In fact, I wanted to go to the same treatment center where I went in 2009, but I was so unstable and I was still quite manic. It took a month of medication management to calm me down enough where I could even tolerate going to treatment for the drug issue. And I mean, I was too talking a million miles a minute. I wouldn't be able to sit through a group. We went to several treatment centers. They wouldn't take me. They actually said when you're more stabilized, you can come back.
Mm.
So finally, I called. I have a
I
disability.
have to interrupt with that. That's not something you typically think uh, when you're trying to get into it. I mean,
They
you don't
would.
typically think that, right? Because I mean, you think most people are kind of
They said
really
they had one
struggling.
psychiatrist for 114 patients, and they would not call my neurologist.
Okay.
And I said, well, this isn't the place for me. I need
Yeah.
somebody who's going to call my neurologist.
Right.
My husband and I were with it enough to know how to advocate for myself. And I knew I could get well. And basically, I called the treatment center where I had been in 2009, which happened to be out of state, out of town. And I went to Atlanta. I got on a plane and I went to Atlanta and I stayed there for 3 months in a residential treatment facility.
And during that period of a month waiting to get in there, were you on lower doses of cannabis so that you could
Not only
maintain?
lower, I was taken off completely.
Okay.
I mean, I was a month sober by the time I got there, but
Okay.
I wanted to really be well and
Yeah.
I needed help, but I was off the cannabis, but I was very heavily medicated for this manic episode which had happened, and I'd never taken medications such as these. They were very sedating. I I wasn't myself even then from the medications. Like it was almost, and then I went into a very deep depression after I got there. On the flip side of it, I guess that's common for this. Oddly enough, when I got home, I've been sober now 8 months after this episode.
Congratulations.
Thank you, thank
That
you.
is a very big deal.
Yeah, I'm very happy with that. and I know, I'm doing well, and I'll continue to do well, um, with dedication and taking care of myself and that kind of thing. But what was I going to say? When I got home, I was, in a support community for alcoholism and addiction, and I met someone whose husband had Parkinson's, and he had very similar thing happen to him, not
Wow.
necessarily triggered by cannabis, but it was levodopa induced. And he developed a mania from levodopa. And I think it was sort of the perfect storm, the combination of increases in my levodopa because they had doubled my dose. And very shortly thereafter, I presented with mania within a month
Mm,
of that.
yeah.
And so when I was in the hospital, actually, they took my levodopa all the way down to half a pill 4 times a day, which was nothing. It didn't control my symptoms. And so I had a lot of dystonia, tremor, and even some withdrawal initially from precipitously lowering my dose. And it wasn't until about a month ago that I've been well enough to tolerate going back up on the levodopa. And now I'm at a full therapeutic dose on that. And I'm actually getting better control of my symptoms. But I
So
just,
you were dealing in rehab with like just magnified symptoms of Parkinson's because you obviously weren't taking any cannabis and you were on a much lower dose. Like
right.
how was that? Like I would assume
Well,
that
they had a doctor there who was an addictionologist who was very familiar with neurology and psychopharmacology. I mean, it's one of the reasons I chose that place, and they were willing to work with my neurologist. So they actually spoke to my neurologist, and they would communicate. In fact, they wanted to try me on a medication which I had never taken before, and my neurologist said he preferred that they didn't, and they switched course and chose a different medication. But, had I not advocated for myself and just gone to the local treatment center that had one psychiatrist for 114 patients, I don't think I'd be doing as well as I am. And actually, 8 months ago, or 5 months ago, when I actually returned from the treatment center, I was on 5 different medications, 5 psychiatric medications. And now, now I'm on 2, like a small dose of antidepressant and something to stabilize mood, so I don't go up to the high end. But the whole thing was just horribly frightening. And I feel like now, I'm really back to myself and my baseline, but I didn't realize that I was really in trouble. I really didn't.
yeah. Oh, that's hard.
But now, Mel, my anxiety is just really well controlled, and I don't have any paranoia. And, with the clarity of vision that I have now, I realize that a lot of that was caused by the heavy
Yeah.
cannabis use.
Yeah, I do think, it is a very popular topic. I get emails about it frequently. What about cannabis? What about CBD? What about, XYZ? And uh, I will think about I want to say it was I can't remember who the initial person I talked to, but they said, yeah, for some people, it might be okay, but this is a disease of the brain. And if you have any sort of cognitive issues and you're going to put something that can create hallucinations or paranoia or anything, um, this is just going to bump it up, right?
Yeah,
But there's also so little data that goes beyond anecdotal data. And people say, hey, this worked great for me for sleep, anxiety, pain, all of those different things. And so um, a lot of people try it. And I think obviously, having an addiction issue, um, you were kind of ripe for going down that path, unfortunately, right?
yeah. But you know, one thing I had to do was see reality for what it was, and recognize that I felt a lot of shame about what was happening, and that was standing in my way of getting well, instead of really just saying, oops, it happened. Let's move forward and do the next right thing.
Yeah.
That's okay. You know,
Somebody here said, I'd love to see how Parkinson's disease affected your relationships, please. So yeah, let's talk a little bit about that. I mean, you've got a partner and you're married, and what was, let's not take the sort of severe route. Let's just go back and, how was Parkinson's impacting your relationship? How was sort of finding the right medication, not having the right medication, being sober? How are those things impacting you?
on a personal level, my husband had never known me not sober. We had been together 10 years, and he knew me sober. He didn't know me with Parkinson's. He didn't know me not sober. So suddenly I was just not acting the way that I always had. And uh, it did affect my relationship, obviously. But, he wanted me to be well, and he's very supportive. And I was willing to get help. And he saw signs that I was improving. So that was great. But there were other relationships, I had friendships with people, and I just wasn't being myself. I wasn't as good of a friend, or I wasn't, focused. I was very self-centered about me and what was going on with myself, and not really focused on others. And that was not my baseline. And so I think a number of people who were close to me were like, something's not right, but maybe they didn't feel comfortable saying something.
Yeah.
And now, now with hindsight, I'm able to look back, and I've reconnected with those people. I mean, this is the first time I've done anything for the Davis Phinney Foundation, because I wanted to be well. I wanted to come back when I was well, and I could sit here and smile and not be like, wow, that was horrible. I'm happy.
Yeah.
I'm happy. I wasn't happy the whole time when this was happening, but I am now. And the reason I talk so openly about it is I'm proud of myself for being able to do what I need to do, and whatever I needed to do to be happy, healthy, whole, and well. And I just would rather share my experience, strength, and hope with other people in a way that can help our community, because I'm not the only person who's ever been through anything like this.
Yeah. Susan says, I'm sober and had surgery that uncovered Parkinson's. My fiance has had to help me be mindful of my tremors and my swallowing. Yeah. So, when you got to the point, I mean, you had anxiety in the past, you've had depression in the past, right? And then you got to the point in 2019 where you're like, I'm gonna try this. What had you tried up until that point that hadn't worked? And what are you doing now that's different, in terms of, behaviors, in terms of tools that you have and things that you've learned?
Well, I go to a lot of AA meetings, frankly. I mean, that works for me, and I love it. It's a great tool for me. I stay very close to the treatment center that I went to, and they have meetings on Wednesdays and Thursdays. I attend a meeting called Caduceus, which is for doctors, nurses, vets, dentists, people who struggle with addiction issues. And I'm very close with that group. In fact, next week, I'm going back to Atlanta for a 3-day intensive revisit. I sponsor other people in AA, and I have a sponsor, and I call them, and I just surround myself with a community that can support me. I have a lot of sober friends, and family members too, actually, and so I just really leaned into them. But I pray for me. Getting back in touch with my spirituality was really important for my mental health. And as to your question about what I had tried before I tried the cannabis, I mean, I was taking medication. I had a psychiatrist. I wasn't taking a specific anxiety medication, but I was working with my neurologist, and he actually suggested that I switch from one antidepressant to another because it was more likely to help me with my anxiety. I mean, I was talking to my doctors and telling them what was happening. I even talked to them about wanting to try the cannabis, and a number of them were like, it's probably not a good idea with your history. And I'm like, well, only I can decide that, really.
Yeah.
So, I was trying other things, yoga, meditation, and stuff, but I just wanted relief. And at first, it was relief to me. And then it created more problems than it solved. And then it wasn't relief. It was just, I'm in a boatload of trouble and I need to fix this.
Right. How did you feel when you did you stop the cannabis cold turkey once you kind of got out of the hospital and came home?
Yes.
Yes, cold turkey. And what did you experience there?
I was on a lot of medication because remember,
So yeah, okay.
the psychiatric hospital and they had given me all these sedatives and stuff. So I was sleeping a lot.
Yeah.
I just was sleeping a lot. And
Yeah.
um, I was being treated by a physician. So, honestly, that time was a bit of a blur. But
Yeah.
going back to rehab, truthfully, what happened is um, rehab, people don't know what it is, I guess, if they've never been, but it's like 50, 60 hours a week of intensive therapy with psychiatrists, counselors, therapists, groups, all kinds of stuff. And you really do a lot of self reflection, a lot of self work. It's great, actually.
What did you find that there were, people in your group that also had chronic diseases and they were managing it with they have to be on medications, right? I mean, this is an issue. You're an addict who has to be on daily medications,
Yes, and
right?
they make me impulsive. Those
Yeah.
medications have side effects.
So were there other people there that that could relate to what you were going through?
Um, Somewhat, I guess there were other physicians and things that people there that were dealing with addiction. I felt like I was among my peers and I could relate to the people that were there, but nobody else really. I've met someone who has MS and another woman with lupus
Mm,
who also deal with recovery and addiction and relapse, and that has helped me, but not exactly Parkinson's. And
yeah.
taking the dopaminergic medications for me, I think was contributing because every time I took them, I was getting sort of like it was hitting that part of my brain that is changed forever,
Yeah.
unfortunately.
This seems like a group that needs to find each other.
Yeah, it is a group that needs to find each other. Maybe I'll start that.
Right? Um, Dark Knight. I do know that it's from Batman, but weird to me. He says, "Does Karen struggle with fatigue? If so, how do you address it?" And then he also said, "Do you still struggle with depression? And how is that? What are you treating? What are you using to treat that instead of the cannabis?"
um, I do struggle with depression. On the right medication, it seems controllable for me and with behaviors that are conducive to mental health and positivity and stuff. But one thing I am doing is I see a psychiatrist weekly.
Hmm.
I pay for that. I'm lucky that I can do so. Um,
And so you're doing weekly talk therapy with this person.
I have a therapist who I talk to, but I also see a medical doctor, psychiatrist weekly, and he's really helping me to try to get prescription medications proper so that
Got
I
it.
don't feel I need those things. So my depression is improved, but even up until about a month ago, I was still struggling with depression. And when I had a side effect of the psychiatric medication where my white blood cell count dropped really low and I had to go off the medication they had put me on. So here I got completely stable after this huge incident of what had happened, and then they had to change the meds again. So I did experience some more depression. I think from the meds. But on the right medication now, I'm on a new medication. Um, I'm doing great, and I feel a lot better. But it's really hard when you're experiencing depression because it's hard to see the forest through the trees. You know, I know for me, what my experience was like, I felt quite hopeless and dark and down and sad. And when you feel that way, at least for me, I didn't want to do anything to help myself. I think throw in a little bit of apathy, and it was just self perpetuating in a bad way. On the right medication, I actually feel a lot of joy and, you know, usefulness and connection with others and lots of things that I wasn't feeling when I was down. Apparently, I think for me, the Parkinson's and the Parkinson's medication took maybe a condition that was this big and magnified it to be a condition that was very big. Um, and so, referring back to what my psychiatrist said, you can't separate those parts of the brain. It's
Yeah.
one brain.
Yep. Yeah. Dark Knight says, how would you say is the best way to help support a person with depression? I have a friend with major depressive disorder. So I'll just jump in as former therapist. I will say it is so different with every single person. And I've actually put people in a car and taken them to their doctor, said, give me your doctor's number. We're going right to the doctor. Depends on if they're, getting treated. That's super important to, support them and they're getting treated. But it is major depressive disorder is a lot. And I don't think that it's anyone's job except the therapist and the psychiatrist to figure out what to do. But it's, friends, you can be supportive. So, Karen, what did people
Sorry.
in your life? That's okay. You sound me. Do you have a little cold?
No, I had COVID about 3 weeks
Oh
ago.
my goodness.
You can't catch it through the
And
computer.
you're like, well, I don't care about that. Yeah, this is hanging on, huh? Like 3
Yeah.
weeks. Oh my goodness. So, what were the people in your life who love you? What were they doing well? What were the ones that were like nailing this? And they're like, oh my God, thank God I had them in my corner.
Just being there, even when
Like for the phone call, for the text,
being
for
there
the
for the
what?
phone call, for the text to step in and say, hey, it's time to step in.
Mm-hmm.
It's not right. You need help. Um, that's true love. That doesn't happen. Not everybody has people that are willing to do that,
Yeah.
for them. They were patient. I think my husband just felt really helpless. He didn't know how to help me. He
Yeah, that's a big
wanted
double
the
whammy,
old
right?
bubbly me back, and it just there wasn't a old bubbly me present, and so I don't think he realized until later. I think we were like, wow, me with stable mental health, the right medication, and sober is very different than me with unstable mental health, the wrong medication, and not sober. I mean, it's night and day. So he was patient. He gave me a chance, to and support, and was there through everything for me. That was the right thing. Um, and involving my doctors was the right thing. Choosing good doctors in the first place that actually care about you.
Yeah. I mean, it sounds like you did a lot of advocating. You had to do a lot of advocating to
Yeah.
get the care that you needed. But your first step was having the right care team in place, right? So that
Yeah.
when you needed to call on them, ask them, you had someone to ask, right? Yeah.
Mhm.
So important. So important.
Yeah.
Um, is your psychiatrist do they specialize in neuro?
No, yes. It took me a long time of trying different people to find somebody who did. And unfortunately, what I found in the St. Louis community is most of the really good doctors that I have found don't take insurance, and
Mm.
they're quite expensive. You can send it into your insurance after the fact and try and get some reimbursement, but I have found that to be the case, unfortunately.
That
And
is incredibly unfortunate. Yeah.
there's just not enough providers and a lot of people who need things from them. And I think that most psychiatrists really mostly just do medication management. And for me, I think the psychiatrist that I had wasn't didn't even say anything. She didn't say, "Oh, you're acting sort of different," or "You seem manic," or "Maybe you're not on the right medication." I mean, he even sent me to a hospital without a psychiatric ward when I was having a psychiatric crisis. I'm sorry, that's not a good doctor.
Yeah.
I didn't know it until afterwards, but believe me, now my husband and I are like very picky about who we go to. And I tried 5 or 6 different ones before I found the one that I currently have. He is double boarded in neurology and psychiatry. He's an addictionologist, which I need somebody who's familiar with addiction medicine. Um, and he's very, very experienced. He doesn't take that many patients. This is kind of his retirement job. And he agreed to see me. My primary care doctor asked if he would, and he agreed to see me. And so I feel really fortunate that I finally found somebody but I didn't give up. I
Yeah.
didn't give up. That was key. I
Yeah.
said, no, this is not right. I went to the university setting because I thought maybe they could help me with the complex mixture of things. And
Yeah.
having a psychiatrist, that's not where I ended up. Actually, I found somebody in private practice, and that's where I landed eventually. But I wanted someone who was actually going to talk to me, not just push pills.
Yeah.
Because I felt, you need to know me. You need to know who I am so you can tell if something's going awry.
Yeah. And if you don't care enough to know me, you're not going to be able to treat me.
Yeah.
Right. I mean,
Yeah. I mean, I
there's a
probably
lot going on.
have more treatment than your average person living in my whole life. And so I'm kind of a connoisseur
Yeah.
of mental health
Yeah.
services. So I
Yes.
knew what good looked like.
Yeah. Well, I want to speak to that a little bit because certainly not everybody is. Some people are alone. Some people are going through things like this alone. What tips, what did you learn over the last year that you think are the really, really important takeaways that you can share with the community?
We are not meant to be alone. If you are alone, it's important to take steps and effort to connect yourself to a community of some kind, whether that's a church community, a Davis Phinney Foundation community, um, a 12-step recovery program community, any sort of community. Go volunteer at Habitat for Humanity. I don't know, but let people know you and get to know others. And despite when you're depressed or feeling down, you maybe don't feel like being that social, but I don't think we're meant to be solitary creatures. And that's why it's so challenging when people are alone. Like when this happened to me in 2009, I was alone actually. And I was not married at the time. And I didn't have the same situation where I had now, but I always had supportive family. So I was able to lean into my family.
Yeah.
Um, so I was fortunate about that. But um, I think because I've had to live with this my whole life, I know that I am somebody that needs community.
Yeah. And for those people who watch who they don't feel connected, they don't have a community, they don't go to a class, and for whatever reason, and that they're willing to take one step. I put our link to finding our ambassadors because our ambassadors are amazing. Karen is one of them. And sometimes it just takes one phone call, one email to connect. Well, just email to connect with them and then get on the phone. And they might have ideas. And it might just be better to talk it over with one person instead of showing up. I'm going to show up at a class for the first time, me and 25 other people that I don't know. So, yeah, take the steps because, we don't want to plan, you don't want to get so nervous and panicked in your life that you plan for this terrible thing to happen. But you also don't want something really hard to happen and you don't have anybody to draw on because imagine if you had just gone through all of this alone. And if you're in a situation where you really need help, like we're always here. So,
I
use
think
us.
too, most people's health insurance will cover a therapist of some kind.
Yeah.
Have somebody in your corner and a professional. I mean, some people just, you need a professional sometimes. It is
Yeah.
good to call an ambassador and have a friend and that kind of thing, but sometimes you really need a professional
Yeah.
too.
I mean, I just think an ambassador is going to say, hey, have you maybe try this? We can help you set it up. They can help you find somebody. They're just a really good person to have in your corner. Like I wish everybody with Parkinson's had a Davis Phinney Foundation ambassador with them to travel this path with. What else, Karen? What else do you want to share with the communities? It's been a ride.
Just that always have hope, you know, always have hope. Um, Things may seem dark at times, but they do get better. And you have to take care of yourself. And
Hmm.
if you hit a bump in the road and you're headed down the wrong direction, it's okay. Just correct your course and get back on track. You know, don't be afraid to ask for help and don't be afraid to try again.
Great. Well, thank you so much, Karen. And we look forward to having you on a lot more interviews and conversations and events that we're doing.
Thank you. I can't wait.
Great. Thank you so much.